What are the lethal congenital abnormalities what baby face during baby's life in the womb? These are the called lethal congenital abnormalities, refers to severe birth defects that are incompatible with life outside the womb. These abnormalities usually involve critical organs and systems in the body such as brain, heart or lungs and other major organs. This result in death either before birth or during labor or shortly after delivery. Some common examples include anencephaly, where parts of the brain and skulls are missing, and renal agenesis, where absence of kidneys, and trisomy 13 or 18, which often result in profound developmental issues. We'll go into the impact on pregnancy outcomes with these legal congenital abnormalities. One is fetal demise. In many cases, pregnancy is affected by lethal congenital abnormalities result in miscarriage, that is called spontaneous miscarriage or stillbirth, especially if the abnormality is severe and incompatible with fetal development in the womb. Number 2 is termination of pregnancies. When the diagnosis is prenatally, some parents opt for termination of pregnancy due to poor prognosis for survival after birth. Unfortunately, this is not a required entity in Sri Lanka in the present law. It is not allowed to do this termination of pregnancies because of the birth defects. Then the number 3 is neonatal death. In cases where the pregnancy continues to term, infant born with those conditions may die shortly after birth or often within hours or few days due to organ failure or other life-threatening complications. Emotional and psychological impact. We will look into what is the emotional component and the psychological impact. Such diagnosis can have a profound emotional toll on the parents and families, often leading to grief, anxiety and difficult decision making about the pregnancy. Number 5 is management decision. That's what we face with the couple. The management of pregnancies with lethal congenital abnormalities often involve specialized care. This includes a lot of things. That is prenatal counseling. That means to discuss prognosis, options and support. Then perinatal hospice or palliative care, which is not that developed in Sri Lanka. If the pregnancy is carried to focus on comfort and quality of life for the newborn. These abnormalities are usually identified through prenatal testing such as ultrasound, amniocentesis or non-invasive prenatal testing, popularly known as NIPT. Upon the diagnosis of lethal congenital abnormalities, the usual process followed in current medical practice involved in multidisciplinary approach to ensure that both the medical and emotional needs of the parents are met. These steps typically followed include number 1, confirmation of the diagnosis. We have to 100% sure of the diagnosis before we take the next step. This is after an initial suspicion of a congenital abnormality, often through ultrasound scan or non-invasive prenatal testing. Further diagnostic tests are conducted to confirm the condition. This may include, we can perform the amniocentesis or chronic or chorionic villus sampling to analyze fetal chromosomes. If the case is more severe and if we detect the particular organ system is affected, such as fetal brain, then fetal MRI can be offered to these couples, or detailed fetal echocardiography depend on the suspected cardiac abnormality. Then the involvement of the multidisciplinary consultation is started. This one person can't do that. Lot of disciplinaries has to come together to form this. These include maternal fetal medicine specialists, genetic counselors, pediatricians and neonatologists and palliative care specialists are involved in discussing the diagnosis and then offering lot of options to these couples. The family is provided with comprehensive information on the conditions the prognosis and the potential outcome of both the fetus and parents. Number 3 is parental counseling and support. This includes genetic counseling. A genetic counselor explains the nature of the abnormality, whether it is genetic or spontaneous, and the likelihood of recurrence in the future of pregnancies. This is very important fact. Lot of mothers ask whether will I get this in my next pregnancy. So this kind of counseling is very important. Then what is the emotional support? The psychological support from a therapist, social workers or support groups is typically offered. This helps parents cope with grief, anxiety and the potential decision making process. Then the number 4 is the most difficult part, that is the decision making. Parents are given the following options based on the severity of the abnormality. They can continue the pregnancy. Some families choose to continue the pregnancy knowing that the baby may die before or shortly after the birth in these cases. Or some mothers, they want the perinatal hospice or palliative care, which is planned to ensure comfort for the baby and emotional support for the family as long as baby survives. But unfortunately, this kind of things are not very well developed in our country. Then some mothers, they opt termination of pregnancies, which is not legal in Sri Lanka at the moment. If the abnormality is confirmed as lethal and prognosis is poor, parents may opt for a medical or surgical termination of the pregnancy. The laws and regulations surrounding this choice may vary depending on the country and the local jurisdiction. Number 5 is perinatal palliative care. In the previous shows I mentioned this part is not that developed in our country. If the couple selected pregnancy to continue, then if the pregnancy continues to term or near term, a birth plan may be established. This plan outlines the care of both baby and the parents with a focus on providing comfort to the newborn and creating meaningful moments for the family. Palliative care teams helps to ensure that the baby upon birth experience minimal suffering and the emotional support to continuously provide to the parents. What kind of support after delivery? One thing is grief counseling and follow-up support are very important. Whether the pregnancy results in stillbirth or neonatal death or a live birth within palliative care. Sometimes some families, they may choose to create mementos such as photographs, handprints of the baby or footprints or pieces of hair to keep as souvenirs or to help within the grieving the process. That sometimes that help when they are grieving period, it helps these memories. Then you have to follow up with the maternal fetal specialist for monitoring and planning for future pregnancies, which is standard practice in our country. Number 7 is future pregnancy planning. If the condition is genetic or has a known recurrence risk, the parents may advise on preconception genetic counseling. An option for future pregnancies, including the use of pre-implantation genetic diagnosis, popularly known as PGD, with IVF, or that is test tube babies. And this kind of early prenatal screening is quite helpful to prevent this kind of bad outcome of pregnancies. This process is highly personalized and involves ongoing communication with a focus on respecting the parents' wishes and values and the belief while providing the best possible medical care and the emotional support. Awareness campaign and the advocacy effort can play a crucial role in addressing the complexities of reproductive health decisions, particularly around the congenital abnormalities and the environmental factors, by focusing one on education, access and the support. Here are the key areas where future efforts can make a meaningful impact on this kind of lethal congenital abnormalities. How to do this? We have to promote comprehensive education on reproductive health. Early education, advocacy effort can aim to introduce reproductive health education at an early age, focusing on prenatal health, genetic risk and the impact on environmental factors such as toxins, nutrition and lifestyle choices. Then we have to make the information accessible to all these vulnerable population. The campaign should ensure that the information on congenital abnormalities, prenatal testing and the reproductive option is easily accessible to a wide audience. This could include online platforms, social media and community programs and healthcare settings. As you all aware, all these things are culturally sensitive. Therefore, approaches should be very meticulously planned, keeping these cultural sensitive areas in your mind. And these are influenced by the religion and the personal values. Therefore, educational campaigns should be inclusive and respectful of different perspectives while providing accurate medical information. Then we can raising the awareness of environmental risk factors. Environmental risk factors now all know global warming and the lot of toxins and polluted environment we live. Therefore, there is a huge impact of environmental toxins. Many congenital abnormalities can be linked to environmental exposure such as air, water pollution, pesticides, chemicals and in-house products which we use as a cleaning agent, detergent. Then this maternal exposure to harmful substances. As we know, there are a lot of alcohol users, smoking and the narcotics, drugs, there are a lot of things can affect to have a healthy baby. Campaign should educate the public about this risk and advocate for policies that reduce exposure, especially for pregnant women. Then we have to advocate for policy change. Advocacy effort can push for stronger regulation on environmental hazards, workplace safety standard and public health initiatives that aim to minimize exposure to teratogens. Teratogens are substances that cause birth defects. Community has an immense role in this. Community engagement and the engaging these communities through workshops, local events and the partnerships with environmental organization can help raise awareness of how local conditions, example water quality, air pollution, how they impact on reproductive health of our women. We have to promote the prenatal screening and genetic counseling. As we are aware, at the moment, access to this prenatal screening and genetic counseling is limited because it is very expensive. Access to prenatal testing and advocacy efforts should focus on improving access to prenatal testing such as ultrasound, non-invasive prenatal testing, NIPT, genetic testing and especially in underserved population. Increased access helps parents make informed decisions about their pregnancies. Then we can divert this into insurance and financial policies. The campaign should also advocate for better insurance coverage for prenatal testing and genetic counseling services, as these are a bit expensive. This would help alleviate the financial burden on families who want or need comprehensive prenatal care. We have to improve genetic counseling services. For that, we have to raise awareness about the importance of genetic counseling before and during pregnancy. This can help families better understand their risk and options, particularly when there is a known family history of congenital abnormalities. Then we have to make aware and increase the support of informed decision making. This should be non-judgmental care. Advocacy campaigns should emphasize the importance of non-judgmental, compassionate care for families facing difficult reproductive health decisions. This includes supporting both parents who choose to continue their pregnancies despite a poor prognosis and very bad outcome, or especially those who opt for termination. That is a very difficult decision. Informed consent, ensuring that parents receive comprehensive, unbiased information about the diagnosis, prognosis and available options, including prenatal palliative care, is essential for informed decisions making. Campaigners should advocate for healthcare providers to be trained in delivering sensitive and clear communications. Then we have to make awareness of support for these mothers mental and emotionally. This includes grief counseling and emotional support. So campaigners should raise awareness about the mental health impact on pregnancies affected by the congenital abnormalities. Advocacy should focus on ensuring that parents receive appropriate emotional and psychological support. This includes access to grief counseling, peer support groups and mental health services. Generally, having a child with congenital abnormality is a stigma in the society. We have to reduce this stigma. Many parents who experience a diagnosis of lethal congenital abnormality or who choose to terminate pregnancy face social stigma. Advocacy campaigners should work to reduce this stigma by fostering empathy and understanding within society and emphasizing the complexity of these decisions. Then fostering community and the family support networks, building support networks. The campaigners can help create spaces for parents and families to share their experience, whether through support groups, online forums or advocacy organization. Peer supports can be crucial in helping families navigate the emotional and the medical complexities of these situations. Family education is very important. Encouraging open dialogue within the families about the reproductive health can foster understanding and support when difficult decisions need to be made. Then we have to focus on advocating for research and innovation. Investing in research advocacy effort should call for greater investment in research on congenital abnormalities, including the genetic, environmental and epigenetic factors that contribute to these conditions. This includes funding for new prenatal diagnostic techniques, therapeutic interventions and the preventive measures. We have to focus into technological innovation to make the awareness of this congenital lethal malformation. We have to support advancement in prenatal care such as better image technologies, gene therapy and the early detection methods that can help parents make informed decisions sooner in their pregnancies. Other area is very important in our country, that is legislative and policy advocacy. We have to protect the reproductive rights of a female. Advocacy campaigners should work to ensure that parents have access to the full range of reproductive health services. This includes termination of pregnancies regardless of the diagnosis. This includes advocating for laws that protect reproductive rights and ensure equitable access to care. Workplace and the maternity protections are very important. Campaigns can also advocate for policies that protect pregnant women from environmental hazards and the occupational hazards and ensure that they receive adequate maternity leave and the medical support during high risk pregnancies. Partnering with the healthcare providers is very, very essential. Training of providers is very essential. Advocacy efforts should push for better training for healthcare providers in delivering sensitive diagnosis, offering supportive care, and providers need the tool to communicate effectively and compassionately, especially when discussing congenital abnormalities and reproductive health options. Collaborative decisions making. Campaigns should emphasize that the importance of collaborative approach in reproductive health where parents, healthcare providers and the counselors work together to make informed value-based decisions. By addressing these areas, awareness campaigns and the advocacy efforts can help families navigate the complex decisions related to the congenital abnormalities and environmental factors, improving reproductive health outcomes and empowering individuals to make informed, supported choices.